Hi, my name is Paige. This is our skin and abdominal assessment video for Maryville University, Nursing 612. This is my practice patient. And when I walk into the room, I would first introduce myself, make sure I wash my hands, and identify the patient using two identifiers. So first I'm going to have him read the statement.
I, Hayden Bowen, voluntarily give Maryville University permission to record my image and or voice and grant Maryville University all rights to use this recording in any medium for educational or other purposes that support the mission of the university. I understand that the following information will be gathered by a Maryville University student as part of a course assignment. I give my express consent for this information gathering and physical assessment to be filmed and posted in the student's course shell for access by faculty and students at Maryville University. I further acknowledge that since the recording is for educational purposes only and the information is not meant to be diagnostic, therefore Maryville University, the faculty, staff, and students are not considered liable. The recording will be deleted by the student in any of their devices as soon as it has been reviewed and graded by the instructor.
Now do the room scan. Perfect, thank you. Okay, so the first thing we're going to do is the skin, hair, and nails part of the assessment. We'll start with the hair, noticing any hair loss or irregular distributions of the hair. We'll also note hair texture. We'll also want to palpate the scalp for tenderness and any lesions or irregularities there. Then we can look at the nails, looking for cyanosis and clubbing, which everything looks normal. We'll want to just check out the skin, just to check for any abnormal coloring, any diaphoresis or dryness, anything like that. We'll want to look for rashes and lesions and any scarring. Then we can move on to the abdominal part of the assessment. I'll start with the CVA. You can go ahead and turn around, just since he's already sitting up. So for this part, this is checking for tenderness in the kidney area. So we'll want to find the 12th intercostal space, which would be about here, and then go up to find the spine, and then go up to the angle between the rib cage and then the spine. And we'll just gently tap on the back of my hand here, noting any tenderness. If there is tenderness here, that could be an indication of a kidney infection. Go ahead and lie down. Then we'll move on to the rest of the abdominal assessment. First, we're just going to inspect for any irregularities, any masses, trauma, or scarring, lesions of any sort. Everything looks normal. So we'll want to first auscultate, just because we don't want to be pushing on the abdomen. That can elicit irregular bowel sounds. So we'll listen first in each of the quadrants. To get a really accurate assessment here, we would want to listen for about 5 minutes before we can say that bowel sounds are absent. And while we are auscultating, we can also listen to where the liver would be, as well as the spleen, and noting any rubs. We can also at this point listen to the arteries of the abdomen, starting at the top with the aorta, and the renal arteries, the iliac, and then the femoral. And here we're just auscultating for any bruise. Once the auscultation is done, we can move on to percussion. We'll again percuss each of the 4 quadrants of the abdomen. And this should sound more tympanic rather than dull. And then as we move on to percuss the liver and then the spleen area, that would be where we would hear more dullness. And we can also check the liver span. We'll move from inferior to superior, and then we can get an idea of where the liver border is, which would be about there. And now work superior to inferior, which would be about there. And normal is about 6 to 12 centimeters there. And then we can do similar with the spleen over here at the anterior axillary line. Take a deep breath. Go ahead and relax. If that is dull, but if it was abnormal, that could be a sign of splenomegaly. And while we are here, we can also assess Murphy's sign. Go ahead and take a deep breath. Where we palpate over the gallbladder region, and that will check for any gallbladder stones or infection. Go ahead and breathe. Once the percussion is done, we can move on to palpation of the abdomen. We'll want to start with a light palpation. This is mostly just to assess for tenderness. We can also kind of tell if there's any masses or irregularities there, but we'll want to move on to a deeper palpation where we can assess the liver. And if we can palpate the kidneys, that could be an abnormal finding as well. So once we've palpated, we can then move on to, there's four signs we can check for when it comes to assessing for appendicitis. The first one we'll do is called McBurney's point, which is a line, we draw a line from the umbilicus to the superior iliac spine, and then about less than half of that line is where McBurney's point is. If there's tenderness here, that could be a sign of appendicitis. Or also we can go over to the left side and palpate the left side, and if there's rebound tenderness over to the right side, that could be a sign of appendicitis as well, and that's called Roving's sign. The third test we can do for appendicitis is psoas sign, where I'll put my hand on his knee and have him lift his leg up, and if there's tenderness in that right lower quadrant, that could be a sign of appendicitis. Then the final one is, perfect, the obturator sign here, where I will pull out his foot this way and then kind of push on that. If that caused right lower quadrant pain, that could also be a sign of appendicitis. And that is all for our assessment. Thank you.